Hi, everyone. I'm Madeline Heim, Health and Science reporter for the Post Crescent and USA Today Network Wisconsin. Thanks for joining me for another Newsmakers Coronavirus Edition. Today, I wanted to talk about an important piece of the puzzle when it comes to getting coronavirus cases under control in Wisconsin, and that is contact tracing. And if you've been watching the show from the beginning, you'll remember probably that I talked about that in an earlier show about what the state was trying to do to boost their contact tracing efforts. And from the state's perspective, it's a really sort of staggering task. For example, in the last 7 days, there's been 2,959 people that tested positive, and if each of those people interacted with, say, 5 people in the last few weeks, then that's 14,795 people for contact tracers to contact. And that's a ton of people, and it's just 1 week. So today I wanted to break it down to the micro level and the person level and just drill down to see exactly what happens. So my guest today is Korina Aghmar. She's a nursing supervisor for the Outagamie County Public Health Division. And we're just going to chat a little bit about what goes into the process of contact tracing and what you can expect if you get a call from a contact tracer, which is fairly likely for people, I would say, in the next, months and years as this plays out. So first, I just wanted to start with a little bit of background. I think that people forget that contact tracing has been around for a long time as a public health strategy, and we're just hearing a lot about it now. So Korina, I'm curious, what other viruses have you contact traced for? And is there anything about this virus that makes it more challenging or different in any way to trace for than other things that you've done in the past?
Yeah, you're right. Just to add to what you were saying, it is one of the oldest, contact tracing is one of the oldest tools used in our prevention toolbox in public health. It's a extremely vital process used to this day to prevent the spread of illnesses like active tuberculosis or pertussis, are two that I've used personally. One of the things that makes this virus different is just that it's so new that there's so much that we're learning and that is just not known about the virus. So for example, our tracing is based on the infectious period of an organism. And we're still learning about what that is with COVID-19. So those guidelines can kind of change, and that's one of the challenges. Our team is really good about staying on top of what the current guidance is. And we have a process for being alerted immediately to any of those changes. So, and then communicating those two changes to the contact tracing team in a timely manner.
Gotcha. And so how many people in Outagamie County in the public health division are doing contact tracing at a given time? And I'm curious, are there people for whom that's their whole job, or is it mostly people who have other jobs, but they just devote some of their time to do this?
So right now our tracing unit consists of about 10 different investigators that follow up and monitor positive and what's called probable cases, and then also household contacts. And then that includes 2 staff from other divisions who have some of their other roles to complete in addition to the contact tracing. And then they also follow up with close contacts. We have an additional 5 staff that are trained to assist with just the close contacts as needed. And then there are currently 4 nurses, 1 full-time, 3 part-time, that were retired school nurses that came back to do just the only COVID-19 case investigation, and then also the contact tracing. And that's something that we do anticipate that in the future we will need more people dedicated solely just to COVID-19 follow-up.
Yeah, definitely. That makes a lot of sense. So just to sort of walk through, what this whole process looks like. So let's start from the beginning of the chain here. So if I get a positive COVID test and then a contact tracer calls me, what would they start by, what would they ask me?
So we usually start an interview with gathering demographic information. And then we move on to clinical information. So kind of like your medical, any medical histories or of significance. We then talk about what your symptoms are, what your symptom onset was, and that helps us determine the infectious period. And then we'll get more information about where you work, activities that you may have been involved in during that infectious period, any travel that you may have done. And then based on that information, especially provided about the symptom onset and the infectious period, we move on to collecting information about people that you may have come in contact with, so then they can be notified of the exposure.
Gotcha. Okay. And so in that step of notifying the people that you've been in contact with, I'm curious about, who counts as a contact. If I was working in like a large factory, would every person who works in there with me be a contact, or like just the people that I work right next to, or how is that decided?
That's a good question. So we use the Wisconsin state guidelines for determining who a contact is, and then how to define what an actual exposure is. So contacts are determined based on the duration and type of exposure. And we take into consideration factors like physical proximity, potential for any contact with respiratory secretions, meaning was that person having symptoms when they were next to you? Did they cough on you? Did they sneeze on you? And then one of the most important tools to take this time to reinforce in order to protect yourself from being exposed is maintaining physical distancing of at minimum 6 feet. So it would depend in the factory, if you were working, if you were maintaining that 6 feet distance, then you would not have to be concerned about that exposure.
Mm-hmm. Mm-hmm. Yeah, that's interesting, because I remember, way back when we had the first case in Madison, and that was someone who had flown on a plane, and then everyone, I was so curious, do you have to check every single person on the plane? And they were like, no, you only check the, 2 rows ahead, 2 rows behind, and then the seat next to them. But that makes sense with social distancing. So
yes.
Yeah. That's really interesting. So another question about, the contacts is, what if you can't name your contact? Like, what if you went to the grocery store and you checked out with the cashier and you don't know, or you went to a grocery store and you interacted with a bunch of people and you don't know their names, so you can't, help the contact tracing in contact with them. How does that work then?
So in the event that we did need to contact a large group of people that were, say, in a grocery store at an event or a location, we would really elicit help from the employer or the organizer of that event, and then we would engage in some type of mass notification of people and have them kind of contact us if that were to occur. And our hope is that one still continues to maintain the physical distancing. And what we're noticing in the community is that people are really good about that. So we're thankful that we can continue that even as we reopen to protect the spread.
Yeah, definitely. Have you, just out of curiosity, have you had to do any of those mass notifications yet so far?
Not yet. And I'm going to knock on wood.
No, I will too. Yeah. Yeah. And so I also am thinking about, so the interview process and getting all the information from the person sounds like it's obviously just crucial. So I'm wondering, sometimes with COVID and with other things, I'm sure people are, they get really ill. And so I'm wondering what happens if a person is too sick to be interviewed.
Yes, and unfortunately that has happened personally when I've tried to contact people. It does happen, and we are cognizant of that. Sometimes the person is actually in ICU and they can't speak. So then we really reach out and we connect with our community partners, such as hospitals, and we might work with the nurse who has more of that direct client interaction to get the information, or with other family members.
Gotcha. Yeah, that makes sense.
Everyone's been really willing to provide that information, and thankfully. Yeah, that's good for sure. So how many contacts does average, how many contacts does a person have? And I'm curious, specifically
we were in the stay-at-home order where people weren't moving around as much. So I'm wondering, how many on average was it then? And then, how many on average is it now that that doesn't exist?
Right, and there has been a shift in that. So when we had the stay-at-home orders, a lot of the contacts were household contacts. And so that really depended on the size of the family, or if there were people that were staying over at least one night in the home, then they would be considered a household contact. Now we're seeing what we call more close contacts. So on average, say one positive case may have about 3 or 4 other close contacts in addition to their household contacts. And that may not include work contacts either. So about 3 to 4 per case. It is something that I anticipate might increase as we continue to reopen. And so we're trying to be cognizant of that and train other staff members to be able to do the contact tracing part for those close contacts.
Yeah, that's interesting to me. I think I had read somewhere that like on average when we aren't in a global pandemic, that people have like 20 to 30 contacts that they'll see within a week or something, and you could imagine that if you're going to a baseball game or some other large event, that just multiplies really quickly. So yeah, it'll be interesting to see how the contact tracing teams have to expand going forward as people sort of get back to that.
Yeah, something that you probably never thought about before this pandemic. How many people you come in contact with.
Yep, exactly. It's just wild. Okay, so once that part is over and once you've done that interview, how long does it typically take before you reach all of the contacts?
So our goal is to have all of the contacts notified within 48 hours. If we were notified of a contact by either another health department or through a positive client interview that was completed, we would reach out to them right away to interview in order to notify either the health department that there was a client in their jurisdiction that was a close contact, or to notify that close contact themselves.
Gotcha. Okay. And so at that point, when you're calling them, what do you tell them? Do you ask them questions also, or is it more of just a, hey, please monitor yourself because you've been exposed, that type of situation?
So it is a lot more of the notification. So we call them, we inform them that they are a contact, they've been exposed to a person with COVID-19. We let them know that they may or may not be aware of the person who they were exposed to, but that's not information that we can disclose. We then provide a lot of education about how long to quarantine, what quarantine means, how to monitor for symptoms, and when they should seek medical care. And then we provide additional educational materials or links to resources as needed. So it is more of an education.
Yeah. No, a lot of good information for sure. Are people, this is again, just out of my own curiosity, are people nervous when they get those calls? And, do you have to do any talking down of like, just monitor things, or how do people respond?
So I think for the contacts, a lot of people, in my personal experience, have some awareness that the person had tested positive. So they already have an idea. And because our community partners and the media, just everyone has been so good about telling people what to do, that really makes our job in public health easier. Everyone kind of already knows, I know I got to stay home for 14 days and monitor. So, we really are thankful to our partners in the community for reinforcing that message. Sometimes for the positive cases, people are surprised that they tested positive, especially if they weren't having any symptoms. And so then it is our role includes supporting that person with being tested positive, especially if they've taken steps to prevent themselves from getting infected. It can be kind of a shock.
Yeah, absolutely. I definitely, I can't imagine it, and I hope I don't have to go through it, but yeah, for sure. And then, so, in the case, it sounds like people have been super cooperative, and that's awesome. But, what if someone doesn't ever respond? Or, how many times do you try And, what different avenues do you try to get through to people if they're not picking up the phone or they're not getting in contact with you?
Yeah, and that's a good question too, because we do live in an age where people may not answer phone calls that they don't recognize the number. So for positive cases, we try as many times as is needed to contact that individual. For contacts, just like any other disease we're following up, we have at least 3 attempts at 3 different times using 3 different ways. So for our county, what that usually looks like is we start out with a phone call from our desk phones. That number does come up restricted or blocked. So then we may try a different phone which isn't blocked. And then we may try a letter or calling after hours. And a lot of times calling after normal business hours, we're able to reach a lot of the people.
Yeah, definitely. Yeah, I think, in things that I've read, it's been a lot of messaging of like, okay, if a random number calls you, your instinct is to not pick up, but you actually should pick up because it could be a contact tracer like trying to get in touch with you. So yeah, it'll be definitely interesting to shift people's, decisions about whether to answer those phone calls.
Yes, I agree.
Mm-hmm. And then, so, in rare cases, I would assume, but, do you have strategies to get in touch with communities that are harder to reach or, for example, like in the event that someone is homeless or if someone doesn't have a phone, or I guess you said the letter thing, but, what would be the avenue to reach people that, might be a little bit harder to get in touch with?
Yeah, so we, again, work really closely with our community partners for people who may be experiencing situations where they aren't able to stay at one address or they may not have a physical address that they're tied to. In those situations, we connect that individual to resources that they need to safely carry out the isolation or quarantine orders, and then assist them in creating a plan for when they're off isolation or quarantine for what they're going to do. So we haven't yet come across a situation where someone didn't have a phone. Again, I'm going to knock on wood. That seems to be something that everyone has, but we have had situations where people were experiencing, like they didn't have a stable housing situation, and we were able to work through that.
Yeah, that's really good. And it definitely doesn't surprise me that, there are lots of partnerships and stuff to help that get underway. So that's
Yeah.
really great to hear. So then at that point, when you've called the contacts and let's say, you've contacted all of them, got in touch with all of them, is that where it stops then? And then you just repeat that process, or is there anything else to it at the end of that?
Yeah, so after the initial call for a positive, there may be other jurisdictions to contact depending on who those contacts were identified. So that may take some time. There may be facility or employer contacts that we need to reach out and notify them of the exposure. We need to communicate that needed information to our fellow contact tracers in case there's any follow-up that may need to be completed in our absence. And then we need to document everything. So it does take some time after. Usually each person who's involved in this can have 1 up to 2 positive cases a day. And then there may be 4 or 5 contacts. So 1 or 2 cases can take up all day.
Mm-hmm. Wow. Yeah, that's crazy. Well, I mean, with that in mind, then of course it makes sense why we'd want to keep the cases as low as possible if that's, if just 1 or 2 could take all day. Yeah, for sure. And then, so do you have to do you follow up with the contacts after at all? Or do you follow up with the positive cases at any point, or is it just that first phone call and then that's it?
No, the positive cases, we do our initial phone call, we touch base as needed. It's a kind of an individual decision, and then we always follow up because we have to determine that they can be released from isolation. And so we have to do that initial or that final kind of phone call. And then the contacts, it's depending on the situation and depending on that initial assessment. Ideally, we would do the daily monitoring. The Wisconsin Electronic Disease Surveillance System, WEDS, does have a way that people can do email monitoring, and that's really nice. So they can kind of self-monitor and put their symptoms themselves in, and then we can check those daily.
Gotcha. And then that kind of leads in well to my next question, which I know that, we've seen other countries when they do contact tracing. I think South Korea, a couple others were using cell phone data to track people and make it easier on them to contact trace. I would assume that we wouldn't see that here just because of, freedom of people's privacy and everything. But I'm wondering, are there plans for the county to use any sort of different technology or an app or anything like that in the contact tracing efforts as you go forward, especially with the possibility that there could be a bunch more of these, hopefully not, but a bunch more of these that wouldn't be needed?
So, we're always exploring different ways that we can use to keep the community safe, and exploring what will work for our community. So we have not heard of anything that is going to be implemented like within the next couple months or anything, but it will be interesting to see what the state is recommending. And then we usually take our guidance from the state for our own community level.
Gotcha. Yeah, that makes sense. It will be interesting to see if they recommend anything. I will definitely be watching that too. And then just closing out here with two last questions. First one is, just to help you guys out a little bit. What should we do to make sure that we're as helpful as we can be to a contact tracer if they call? I know my mom keeps a very detailed list of all the outings she's made over the last couple of weeks. And so that's like one strategy. But I'm just curious, what would be the most helpful that we could be in the event that we're going to have to get a call from a tracer?
I think we touched on it before. That's interesting that your mom said that. That's great. Anyone who wants to do that can do that as well. But it's really helpful if people answer their phones and just realize that the restricted or blocked number could be a contact tracer trying to call you. Make sure that your voicemail is set up and that it's not full. And then check your voicemail because we may leave a message. And then also check your mail. And if it's from, like a county, open it up and respond to the number there.
Gotcha. So just be ready to respond to that call. Yeah. Or letter. Yep. Yeah. Makes sense. Got it. And then, I wanted to end with, a little bit of a bigger picture question and, getting back a little bit to my previous questions about, what if someone never calls back, things like that. Does contact tracing have to be like perfect or near perfect to work? What if one or two contacts slips through or things like that? Does that derail it, or do you think that it's just best to have, something rather than nothing to work off at all?
I am hopeful that we can eradicate this. So in my hopes and efforts that this can be eradicated, we need to be able to find every single infected person and any potentially infected person for full eradication. And we touched on a little bit before in this interview, but public health can't do this alone. So everyone in the community plays an important role in practicing these preventative measures and supporting those in quarantine and isolation. And I think if we're all in it together, then we can achieve that eradication.
Yeah, absolutely. That is really great. And I hope that as well. And I'm sure everyone watching this also hopes that. So hopefully we can get there. But thank you so much, Korina. I think this will really help people know more of what to expect if they get a call from someone working with you down the line. So I really appreciate you coming on the show. And I think it was really great. So this show will be back in 2 weeks on June 17th. But until then, you can find all of our coronavirus coverage as well as all of our protest coverage on our 10 Gannett sites. But until I see you again, thanks for watching and have a great day.
Thank you for having me. It was a pleasure.